If you've had a severe traumatic brain injury or a severe TBI, then most likely you were involved with a significant motor vehicle collision or car accident. You had a fall from a significant height, 10 feet, 20 feet. You were assaulted, or you were involved in a sporting event and a bat or something very hard and fast hit you, probably causing a skull fracture. Or, as with many folks that I've seen, you were in active duty combat and you had an explosion, or you had shrapnel or even a bullet wound that caused your head to either be moved back and forth tremendously quickly or violated or damaged your skull and penetrated your skull. And each of these injuries, whether there's a skull fracture or not, results in significant bleeding inside the brain. Folks who have had a severe injury have always been brought to an emergency room and to a hospital because they are requiring significant medical care, neurosurgical and trauma care. A significant number of individuals who have this type of injury don't survive and may either not survive to get to that emergency department or the intensive care unit, or if they do, that they sometimes can even have a death in the hospital. If you're watching this, clearly that has not happened to you and you've survived, and that's wonderful. But during the initial or first part of the injury, you would have had significant difficulties. You would have been in a coma or had a disorder of consciousness, had no awareness of your environment for at least 24 hours, sometimes longer. You likely had weakness in one side of your body, arm and leg, in a rare case on both sides of your body, both arms and legs. Often you'll have facial weakness and a facial droop or difficulty with swallowing, moving your eyes. In rare cases, you can have difficulty with tasting things or hearing things, but usually you can't swallow easily. Your face doesn't move fully normally. One side of your body is very, very weak. Some people may think that's what a stroke looks like. And in fact, there are a lot of similarities because in a stroke, there's a specific part of your brain, usually on one side that's damaged. Usually the opposite side of your body will have weakness, maybe some numbness to it, incoordination. The only big difference is that with a severe traumatic brain injury, while you may have bleeding only on one side, almost always both sides of the brain were affected, either by the rapid movement in the car accident or when you had the long fall, or if it was a bat that hit you or some other device or shrapnel, there was swelling in your brain caused by that penetration of the skull, and that swelling affects the entire brain. So folks who have had a severe traumatic brain injury will usually have more thinking, behavior, functional difficulties than someone who just had a stroke. So the recovery period is usually longer, with all things being equal, between a severe traumatic brain injury and a stroke. Both are significant. Both require you to go to the hospital, go to the emergency department. If you've had a stroke, get to the emergency department, get cared for. If you've had a brain injury, you've been in the emergency department, usually you can be stabilized and out of the ICE intensive care unit or the acute part of the hospital in somewhere between 3 days and 14 days. That's the typical range. And then after that, most people who have had these significant injuries will require a long period of rehabilitation, whether that's in the hospital for 3 to 4 to 6 weeks, or outpatient for a month, 3 months, or sometimes even longer in a nursing care facility because the injury was so severe, or outpatient services for as long as 12 to 18 months to really perfect and improve a lot of these difficulties. Many people with severe injuries will get near normal or normal recovery over the course of 6 to 18 months. A small number get well within 3 months, but most it takes at least 6 months to 18 months. But there are a percentage of people, sometimes up to 30%, who still have difficulties after that. They may have difficulties with walking, with some of their thinking skills, or just high-level functional tasks, driving a car, working, playing, return to sports, return to the military theater. It's unusual to get that high level of recovery where you can go back to being a professional athlete or return to the military. I've seen that. Does occur. There are some professional athletes out there who have had severe injuries. It's fairly unusual. But most people do make a significant recovery, can have a full and meaningful and productive life and return to the things that give them pleasure.